Hey, our special guest today, our regular guest, Dr. Jerome Williams, is with us from time to time, and on occasion, Dr. Mary Battistellar is with us today as well. Great to see both of you.
So good to be here.
All right, so Dr. Battistellar does, or Dr. B, as we like to call her, she does holistic medicine in treating pets.
Yes.
And how different is that from what
we're
normally used to? Yeah.
Well, a lot of things that we get, that I get calls on, have to do with chronic disease or
maybe
cancer.
Nothing else is working.
Yeah, or they're looking for a little bit more, or they've gotten a poor prognosis, or don't know where to go, or they've, and this is, you know, they get online and they talk to their dog groups and they say, look into this.
Okay.
And a lot of dietary changes, and so they want some guidance on what to do with these
So
things.
when we're talking about animals or dogs that have cancer, other chronic pain issues, Dr. B is able to work with them, and you've sent people to her, right?
Absolutely. What are those 4 or 5 different areas? Acupuncture and
Acupuncture, Chinese herbs, Western herbs, homeopathy, homotoxicology, which is something different. I use that a lot with allergies. And nutrition is big because we do a lot of changes in that, and therapeutic nutrition.
Now, you treat a lot of chronic illnesses. Cancer is one of those that you deal with animals a lot, and that oftentimes leads to something like the dog having a seizure or those type of things, which is awful to watch, right?
Yeah, there's a lot of different kinds of epilepsy, and you might see some in the younger years that might have to do with genetic predisposition or a disease of an organ or something like that. As they get older, sometimes it is just they don't know what causes it, and it can be very difficult and frustrating to control with high doses of phenobarbital and potassium bromide, and they use a lot of human anti-seizural drugs, but it tends to make them very not their same personality.
Lethargic and different.
Yeah.
Well, what do you do then?
So I do, acupuncture is quite good for seizures. I look at their diet, I change diet, and also herbal control is very big in not just stopping seizures, but trying to get to the root of the seizure and what's causing it. So.
Go ahead, Dr.
now,
Williams.
if you do the acupuncture, are you using the needle insertion in the head or brain area?
Yeah,
Other parts
very
of the body?
often, very often, and they don't mind it because the needles are solid. It's not like a shot. They don't usually, you can put them in, and they even cats with needles all over their heads. They
So
don't
what's
mind.
the prognosis when you're working on something like this?
I can very often tell if it's a tumor versus just idiopathic epilepsy that's controllable, because there's no response with a tumor, or they may have temporary response and then they start getting worse, and that's when I say, really and truly, to know what's going on, you probably need an MRI. You know, that's some people say I can't afford to go that route. So
Dr. Battistellar is her main office down on Lake Martin, and but you come up once a month.
Come up once a month to Birmingham at Riverview.
All right, if you want more information, you can call Dr. Williams' office as well.
Yes,
Yeah,
the
Dr.
Red Mountain Animal
Williams.
Clinic will be happy to connect you with Dr. Battistellar.
All right, very interesting. You do fascinating work. Thanks, good to see you. All right, let's check in now with JJ. I think.
We can talk some more. I can
We
talk
could.
a long time.